Welcome to Smile Sessions Podcast. I'm Dr. Tony, with over a decade of hands-on experience in comprehensive dental treatments. From orthodontics with aligners and braces, to implants, restorative procedures, and advanced cosmetic work. You'll notice this episode is narrated with AI. This choice is designed to give you a smoother listening experience, while freeing me to focus on research for this podcast and, most importantly, running my practice in Chicago. Today, we're tackling a topic that's equal parts procedural precision and administrative endurance. Navigating workers' compensation claims in dentistry, from injury assessment all the way to reimbursement. This episode is primarily aimed at dental office administrators and practitioners who handle the back-end logistics of these cases in a private practice environment. We'll dissect ICD-10 coding specifics for occupational dental injuries, unpack lien processes under varying state workers' comp laws, with a deep focus on Illinois as our primary example, and outline the claim filing intricacies. For patients impacted by workplace trauma, we'll provide clear guidance on claim timelines and your entitlements to restorative care. Because while the bureaucracy can induce its own kind of toothache, rivaling the sharp pang of an actual alveolar fracture, understanding the system empowers everyone involved. If you've ever managed a patient who shows up mid-shift with a luxated incisor from a warehouse mishap or a fractured molar courtesy of an office equipment tangle, you know these aren't just clinical puzzles. They're intersections of medicine, law, and finance. We'll approach this methodically, starting with injury assessment in the context of occupational origins, moving into coding and documentation, then claim filing, lien processes, and finally patient-oriented timelines and entitlements. Let's dive in. First, injury assessment for potential workers' compensation claims demands a heightened level of scrutiny right from triage. In a private dental office, when a patient presents with trauma suspected to be work-related, say a construction worker with an avulsed tooth from tool recoil, or a factory operator with enamel dentin fractures from machinery vibration, the initial evaluation must document not just the clinical findings, but the occupational nexus. This means eliciting details on the mechanism. Was it a direct blow during lifting operations, repetitive strain from handheld tools leading to attrition, or even ergonomic failures contributing to bruxism-exacerbated cracks? Use standardized intake forms to capture the exact time, location, and witnesses. For dentists, integrate radiographic assessments, periapical films or CBCT for root involvement, and pulp vitality testing immediately, as delays can complicate causation arguments with insurers. Office staff play a pivotal role here. During triage, flag these as potential comp cases by asking about employment status and injury circumstances. Document allergies, pre-existing conditions, like prior restorations that might influence prognosis, and any immediate interventions, such as splinting for luxations. This documentation fortifies the claim against denials, where insurers might challenge if the injury arose out of and in the course of employment, a legal threshold that generally requires a direct link to job duties. Patients, your first step post-injury is notification. Inform your employer immediately, ideally within 24 to 48 hours, to avoid outright denial. Seek care promptly. Delays beyond a week can raise red flags on severity. Complications from poor assessment, misattributed causation leading to out-of-pocket costs, or delayed healing if restorative needs like endodontics aren't addressed early, potentially escalating to abscesses or osteomyelitis. Shifting to ICD-10, coding for occupational dental injuries. This is where precision meets reimbursement. Unlike routine dental billing, workers' comp requires codes that capture both the injury morphology and its external cause, ensuring the occupational tie-in. Core codes fall under Chapter 19 for injury, poisoning, and consequences. For instance, S02.5XXA denotes fracture of tooth, traumatic, initial encounter for closed fracture, ideal for a chipped incisor from impact. Use S02.5XXB for open fractures with pulp exposure. Dislocations or luxations, S03.2 XXA for dislocation of tooth, initial encounter. For tooth loss, K08.419 covers partial loss due to trauma, unspecified class, while complete loss might use K08.113 for Class 3 trauma-related edentulism. To occupationalize these, append external cause codes. W20.8XXA for struck by thrown object at work, or Y92.22 for health service area if the injury occurred in a medical setting. Abrasion from occupational tools, K03.1 for abrasion of teeth, paired with Y93.H3 for activity involving hand tools. In practice, administrators should cross-map these to CDT codes for procedures, D0140 for limited oral evaluation in trauma cases. Billers use sequencing. Primary diagnosis as the dental injury, secondary as external cause, and activity/place codes tertiary. For dentists, accurate coding influences utilization review. Insurers may deny if codes don't align with occupational narratives. Staff, train on software flags for comp-specific modifiers. Patients, understand that proper coding ensures your restoratives, like composite veneers or implants, are covered without personal liability. Complications from miscoding? Claim denials, appeals dragging months, or reduced reimbursements. I've seen cases where omitting Y92 codes led to reclassifications as non-occupational shifting costs. Now, the claim process itself. Once assessed, the workflow bifurcates for providers and patients. In Illinois, under the Workers' Compensation Act, employers must carry insurance covering medical expenses, lost wages, typically 2/3 of average weekly wage after a 3-day waiting period, retroactive if disability exceeds 14 days, and disability if long-term. The Act mandates that accidents arise out of and in the course of employment to qualify, with no fault required, meaning even if the employee contributed to the mishap, benefits apply unless intoxication or willful misconduct is proven. For dental-specific injuries, such as loss of natural teeth, the employer is responsible for artificial replacements, including prosthetics like crowns or implants, as part of necessary medical care. In Illinois, claims are filed with the Illinois Workers' Compensation Commission, IWCC, starting with an application for adjustment of claim form submitted within 3 years of the injury or 2 years from the last compensation payment, whichever is later. Dentists submit detailed treatment plans to the carrier outlining proposed restoratives, e.g. endodontics, D3310, followed by core buildup, D2950, and crown, D2740, and seek pre-authorization for complex interventions like full mouth rehabilitation, post-trauma. In our office, we try to get same-day phone pre-authorization for the initial assessment, and we've found that within 1 week, we usually get the pre-approval back. It's all about building those relationships, as we've worked with quite a few patients and companies over the years to make this smoother. Medical benefits cover all necessary expenses without co-pays or deductibles, paid at the fee schedule rate or negotiated amount, whichever is lower. Administrators in Illinois practices track claims via the IWCC's arbitration process, where disputes over benefits go to hearing before an arbitrator, with appeals possible to the commission and courts. Reimbursement follows the state's medical fee schedule, updated periodically, capping charges for procedures like extractions or veneers to ensure uniformity. For occupational diseases mimicking injuries, such as repetitive stress leading to temporomandibular joint disorders, the Act covers if linked to employment, with a 2-year statute from awareness of the condition. Patients in Illinois. After notifying your employer, expect a claim acknowledgement and direction to authorized providers. You have the right to choose your treating dentist, but the employer may request an independent medical exam to verify necessity. Benefits include temporary total disability, TTD during recovery, permanent partial disability, PPD for lasting impairments like reduced mastication post-extraction, calculated via a schedule, AETYGG, Loss of a tooth might equate to a percentage of facial disfigurement, and vocational rehabilitation, if unable to return to prior duties. Secondary injuries, such as endodontic complications from initial trauma, are compensable if proven causally linked. Complications in Illinois cases? Denials for lack of causation, e.g., if pre-existing periodontal disease is argued as primary, or disputes over treatment necessity, leading to arbitration hearings that can extend 6 to 12 months. Appeals must be filed within 20 days of the arbitrator's decision. For dental claims specifically, ensure documentation proves work-relatedness, as insurers scrutinize facial injuries for non-occupational origins like sports. By comparison, in California, claims involve the division of workers' compensation, with similar no-fault coverage but stricter utilization review for treatments exceeding medical treatment utilization schedule guidelines, and liens filed with the Workers' Compensation Appeals Board. New York generally bars liens on comp benefits but allows pursuit of unpaid balances through civil courts if denied as non-compensable. Patience. Liens don't directly burden you but can prolong resolutions. In Illinois, if Medicare overlaps, workers' comp remains primary with set-asides for future care. Patience, circling back to your guidance. Claim timelines in Illinois require filing within the 3-year statute, with benefits retroactive post-waiting period. Restorative entitlements cover necessities: endodontics for pulp-involved fractures, prosthetics for lost teeth, even orthodontics if occlusion is disrupted. Monitor for denials. Appeal promptly to the IWCC. Long-term, if disability lingers, pursue PPD ratings for dental impairments. Wrapping up, workers' compensation in dentistry isn't just about clinical care. It's about meticulous documentation, precise coding, and navigating state-specific rules to secure reimbursement and ensure patients get the treatment they deserve. These cases sit at the intersection of medicine, law, and finance. When handled well, they protect both patients and practices. Thank you for joining me on Smile Sessions with Dr. Tony. In our next episode, we'll shift gears into the world of cosmetic dentistry, exploring composite veneers with the 3M Filtech matrix system. We'll dive into layering strategies, shade matching, and matrix-guided contouring for anterior aesthetics. Stay dynamic and keep your patients smiling.